I've got a mostly metal knee and I'm running an Ironman this year. The doctor had briefed me before saying, hey, you're going to have chronic pain, unsure of like the mobility level you will have, because I literally snapped my knee in half. I think like one thing that just cannot be understated here is like, if you want to be durable, and we're all fighting that aging curve, the more we age, the quicker we lose muscle. And I think age of 30, by the way, which most people aren't aware, is the tipping point. Obviously it speeds up the more you age and it becomes harder to build back. But it's not like something we should only be thinking about when we're 55, 60, 65. And that's what a lot of people think about when they think about losing muscle due to aging. We all think about our parents, right? We never really think about it applying to ourselves until it happens.
Great. Well, it's a real pleasure to have Alex Birks on the show today. Welcome.
Thank you. Yeah, thank you for having me. Excited to be here.
I am so excited for this conversation. I have been wanting to have another episode on blood flow restriction and how it can be beneficial for women in menopause. We've done several already. And I've been using this technology for, I don't know, the last 4 years, more or less. And I am amazed at how it can help build muscle, preserve muscle. And I really put it to the test. I don't know if the story, but I was diagnosed with osteoarthritis of the hips, and I was told not to do any impact exercise for the last 2 years. It's been over 2 years now. And so when you see your activity levels decline like this, and I know you got your own story, I would love for you to share it too. Oh my God, I'm going to lose all my muscle. And I was just declining until all I could do was just minimal mobility exercises, and then I could no longer walk. And then, so my muscle mass, I always have been doing blood flow restriction. It's been preserved incredibly. And I went into 2 hip surgeries that were 3 months apart with the best muscle tone of my life. And the gerontologist in me is like, okay, I know that sometimes we can't move because of injuries, surgeries, or other reasons. And as a woman also who has this community of peri and postmenopausal women, we know that we lose up to 10% of our muscle mass just in this period, this transition alone. And without our estrogen and other hormones, it's also just a lot harder to build muscle in this phase of life. So this is why I'm like super excited to pick your brain on more of the benefits that this kind of technology can bring to women and their aging selves and maybe their aging parents in midlife. So let's first kind of talk about the terminology, because there's BFR, which is blood flow restriction. Some people say partial blood flow restriction or occlusion, and then sometimes call it targeted compression. So before we talk about those differences, actually, we were talking about, I'm sorry, I'm like going to back up. You come on the Zoom and I'm like, oh gosh, you're very young. So I always think of this kind of technology for people who are older, just because I'm a gerontologist. I know there's other camps out there, but how did you even get into this world of blood flow restriction?
Yeah, so, I came to it because background as a junior athlete, if you will, competed at a relatively respectable national level of sport, if you will. I went to university studying robotic engineering, and it was here playing sport recreationally that I completely snapped my knee. So tibia, ACL, meniscus, all at once. And this led into 2 operations and about 19 months of rehabilitation. And during my physical therapy, I was introduced to blood flow restriction training, or as we like to started calling it targeted compression training, to really just kind of build muscle strength and preserve muscle mass when I was load compromised. That was the way I was introduced to it. And I was load compromised in the sense I had a pretty horrific injury, but people can be load compromised from joint pain, from chronic disease, or just from not liking the stress and strain of really high intensity exercise. And so during this process, I had a really effective experience with blood flow restriction training. I really enjoyed it in that I got really positive results maintaining and actually building muscle strength. But the equipment experience was pretty terrible. I was running around the gym with a big system on an IV pole. It was super expensive, and it just was really not very portable. Like I had to be in the physical therapy clinic to use it. At the time, I was studying robotic engineering at university, and I basically used the laboratory, the university labs, to build my own system that focused on taking the same great technology and packaging it into something that was much more portable, i.e. it fits in your backpack. It was more at a consumer price point, and it met the gold standard of design, as in it calibrates to you, it guides you through setup, it makes sure you don't have any of the contraindications before you use it. And then, now you can even query the app to get exercise sessions pushed back to you, like I had my physical therapist right there, or as close to having your physical therapist right there in the room with you. I don't think you can fully replace the experts. I'm a big believer of that. But yeah, it was really just trying to take that amazing technology and make it more portable and into the home. And I still use it to this day. I've got chronic and intermittent knee pain because half of my knee is now metal. And so I use it as a pre-exercise warm-up before I lift to desensitize to pain. And I use it for accessory work to build muscle strength around, a training plan that I follow. And then, typically in the mornings at a standing desk, whatever else, I'll use the recovery mode to kind of, get rid of whatever muscle soreness is lingering the next day. So that was really my venture into this.
So you have your own pain to purpose story.
Yeah,
I was
exactly.
not ready for that. But yes, as a professional athlete, I can see, we get injuries. And that's when I was researching blood flow restriction and how to use this stuff. I'd go on YouTube and you'd see like two camps, like the bodybuilders trying to get more gains, and you'd have the rehab people trying just not to lose your muscle or build it back. So I would like to just go back to that terminology, because there's so many words thrown around, the occlusion, and you just said compression technology.
Yeah.
What are the differences?
They're all referring to the same thing. Blood flow restriction, compression, targeted compression training all refers to wrapping a compression band around the upper part of your arms or legs whilst doing body weight or low intensity exercise. The compression lightly restricts blood flow out of the muscle, not into it, but out of the muscle, creating a low oxygen environment for the muscle, so that basically you mimic high intensity exercise, tricking your body thinking it's working at a much higher level. That's a very lay description of how it's all working. And so the terms that are thrown around are partial blood flow restriction training, occlusion training, blood flow restriction training, blood flow restriction therapy. And we're really kind of trying to, and they're all referring to the same thing and the same underlying science and principles. We've kind of taken this approach of going into the realm of targeted compression training because it's much more digestible for the consumer. When I was introduced to blood flow restriction training, my initial reaction was, what? There's a little bit of a stalling moment. And I actually think it's quite draconian, right? It's not a cute name. It's not a nice name to hear. And I actually think it confuses people in how the technology actually works. A lot of people, particularly active adults, are very familiar with air boots, the big compression air boots. And most people have had their blood pressure taken with a blood pressure band and are aware of what compression feels like when they wear this. And I think that's the closest thing we can bring when we're, in terms of the vocabulary that people are familiar with, to help them understand, like, hey, this is a very safe and very effective mode of exercise. And in terms of how the technology works, it's very similar to stuff that you're probably seeing in close to your everyday life already. And so we're basically taking the same thing and saying, hey, we're leaning more into the consumer-friendly version of helping you understand this.
That's a great word, and it's a great thing to do, because I remember when I first was exploring this, and I'd go to a class with some girls around. I said, what's that? Blood flow restriction. Oh, that's dangerous. Oh, don't do that. Restrict. Like, that was the first reaction.
Yeah.
Like, oh, no. I mean, from what I've read, it's pretty good. So I think that is a really good place to start. And I'm glad that actually, okay, they're all more or less the same thing. So that's a good thing to know. And so
I do think the addition of partial is kind of helpful when you're talking about the hard science, because you're not fully restricting blood flow. That's not the intention here. It's compression to partially restrict blood flowing out of the muscle, not into it. You're not restricting blood flow into it.
Can you explain then, how does this work? I don't know if it's a little bit more physiological level, because the way I understand it is that this can help, increase the muscle mass. Fabulous. Mm-hmm. It releases the growth hormone. It can improve vascularity, the elasticity of our veins, our arteries, things like that. And it can help us recover better. But what are the sort of mechanisms of action? Can you explain some of those things, like what is actually happening?
Yeah, absolutely. So kind of as you explained already, with light weights, combining the compression with the light weights and slow movements, your body responds by releasing growth hormones, building muscle, and really just improving muscle strength and endurance, all without the stress, the same mechanical stress on the body as high intensity exercise. The thing I think that's always most easy for a lay description is it's really just tricking your muscles or your body into thinking it's doing the same as normal high intensity exercise. But to kind of walk through really how this is happening, you're trapping blood in the muscle. This builds up fatigue faster, forcing the body to essentially adapt like high intensity exercise. This creates a buildup of metabolic stress, signaling to the body to release growth hormones and essentially start the muscle building process. In turn, fast twitch muscle fibers are recruited. These are typically reserved or only recruited under high intensity or high weight training, but are essential in building muscle strength. They're very important for reactions, for explosive movements. And that's not just for athletes. You think about stumbling and catching yourself, that fast twitch muscle fibers balance. And really, when you remove the compression, fresh blood rushes in, flushing out the waste you've just built up. bringing in a boatload of oxygen and nutrients, and you have a much higher prevalence of human growth hormones, meaning that you've really got like a great environment for the muscle to recover in after you've just stressed it, similar to high intensity exercise. One thing I also think is really underspoken about but important is that the repeated action of compression and dilation, if you will, so you're going through the inflation deflation cycles that you go through inevitably when you attach a compression garment, it actually enhances vascularity because it promotes capillary growth and really just improves blood vessel function. And this is similar to much earlier work that's been seen previously with hypertensive patients simply taking their blood pressure every morning. There's been observational work seeing that maybe that's just as helpful or contributes to being helpful as the use of the pharmaceuticals that they're trying to measure. Just doing the compression and decompression cycles can help with vascularity. So that's kind of the way it works. But really, just I always just like to kind of bring it back to you're just stimulating or simulating the similar response to high intensity exercise.
It is. I always tell people, be careful. Sometimes you feel like, oh, how can this be thing? And I say, your brain thinks it's doing 100 burpees. And you feel like it, but your brain and your body thinks that it's exactly what's happening. So,
and I think that's been a misunderstood thing with compression training. And this is actually really important in terms of your first experience with it, because it's, people have often have generally applied a standardized prescription or protocol of compression and set rep scheme with exercise. I don't believe underpins that beyond the initial literature saying, hey, we need a high volume rep scheme because the whole purpose is high volume exercise. But the one of the key modifiable factors for the intensity is the level of compression you apply. And so if you're unsure or you're somebody who's not used to very high intensity exercise, I'd always recommend that you go in at a low level of compression and build up. And the other strategy you can use for this sort of intensity variable is continuous versus intermittent compression. So if you're doing a set rep scheme of exercise, deflate the compression garment between your repetitions. And this would be, the way I describe this is it's almost similar to not holding your weight between exercises. You're dropping your weight. You're actually letting yourself recover. It's almost like time under tension. If you were, in your rest between squats doing a wall sit, then that's similar to keeping the compression on the entire time, versus letting the compression go is similar to actually taking a seat between your squats and going, oh, okay, I'm letting my body recover between sets here. So the level of compression really is more like an exercise intensity variable when you think about targeted compression training.
There's different, I guess, types out there, and you have different modes as well in the ones that you're using. So we would have the constant compression, and when I do that, it feels like you can pick up a baby weight and it feels like you're picking up a truck. Like there's only so much. And for me personally, it's like 10 minutes, I'm done. And I got to really take a break. But if I have something that has a cycle mode, then you're given that break. And or like you said, you can stop and it just gives you a break. Is there any difference in terms of results? Should somebody go, oh, let's just push it, go through the whole 10 minutes, or let's do half an hour, but it'll be cycling in and out?
I have always treated it. This is an interesting discussion that you bring up, because the set rep scheme I often find is similar to is 3x5 better or is 5x3 better in normal exercise training. It's like the best thing is whatever you're going to be compliant with. And so I would always encourage people to consider to treat targeted compression training similar to normal exercise prescriptions. If you are an individual who's not done high intensity exercise in a long time, you wouldn't give a 50-year-old hereditary individual the same normal exercise program as a 25-year-old elite athlete, because it would be miserable. They'd probably throw up. They may even faint. It would not be helpful. Similar with targeted compression training, take an approach where it's like, okay, I need to modify this so that I can build up the intensity. And with that build up in intensity, you will see an increase in physiological results, like the standard progressive overload principle of normal exercise. You should start with a set rep scheme and a level of compression that you can tolerate and complete the full exercise prescription, whether that's self-prescribed, prescribed by a medical professional, or recommended to you within the Suji app. My experience and what we generally see with our customers is that people start with intermittent compression and move to continuous compression almost as like an intense, you're applying that progressive overload principle of, I'm tolerating this. Maybe I don't increase my number of sets or reps, or maybe I don't add a weight to this, but instead of doing intermittent compression, I will do continuous compression because that's the next challenge. Once I can tolerate that, I'll step up with sets or reps. and progress with adding a weight to the mix instead of body weight.
Okay, so I have more questions on the actual Suji app and all these things. But before we do that, I want to talk a little bit more about the recovery in terms of, because I mostly focus on when I think about blood flow restriction, let's just build muscle or just like not lose it if you're going to surgery. I don't use it so much, and I don't have as much experience in terms of recovery. How does this technology help someone recover?
It's funny, we actually, when we launched Suji, we introduced the recovery mode at the request of Dak Prescott, the quarterback for the Dallas Cowboys, because he used it initially, I believe, in rehabilitation, and then started traveling with it instead of his Normatec air boots, because he's like, oh, I can just cycle this compression cycle as if they were Normatecs, but they're way more portable. I don't have to have a full leg boot, and I can actually move whilst I'm doing this session, which means you can do active recovery, like getting on a stationary bike and doing a low RPM cycle effort. The principle of it is very similar to these big sort of air boots or any form of compression technology. By first restricting the blood flow and then releasing it, fresh blood rushes in, flushing out waste and bringing in oxygen, nutrients, which are perfect for recovery. You can do this passively by lying on your sofa, watching Netflix. You can do it in bed, reading a book. You can do it, as I do most of the time, standing at your desk in the morning answering emails. You can do active recovery as well, which is the principle of just wearing the compression garments in a recovery setting where they inflate for say 2 minutes, deflate for 2 minutes, and repeat that cycle 3, 4, 5 times over. You could be on a stationary exercise bike, or you could be doing something that's becoming really popular. Vonda has spoken about it before, Dr. Vonda Wright, who I think some of your audience are probably familiar with, as well as Dr. Kelly Starrett from the Ready State, is compression walks. So actually compressing and just going on a simple walk for recovery as a form of active recovery can be incredibly helpful. And I think, largely a big part of the benefit there is because you're stimulating the muscles more than or similar to normal high intensity exercise, but with low intensity effort, you are signaling that huge release of human growth hormones after you take the cuff off, which is just brilliant for recovery.
And so that makes sense. The way you describe it is, for my next question is, wait, how does this happen? How does this help pain? Because I don't have experience with this either in terms of, I'd never thought of it using it for pain, but kind of like you said, you restrict, all this blood flow goes out, the oxygen goes out there, nutrients are going out there. And I guess that's the same state of mechanism of action to help with reducing pain. But how are you seeing in your community, how are they using it any differently for pain? What kind of pain, like injury or surgery?
Well, both. So injury, surgery, chronic, and even in some instances, kind of acute. So, I mean, sometimes I think it can be helpful to kind of differentiate. So you have muscle soreness, like exercise-induced muscle soreness, which is amazing with exercise recovery. And I would even extend that to things like tennis elbow or runner's knee, where you kind of aggravate some underlying pain during exercise, and therefore you need to get some relief through that recovery process. Then there's the other sort of types or there's another 2 use cases with this for pain, which is what I call long-term healing. Stronger muscles recover faster and they protect your body more. You've got a greater load tolerance to activity. And so if you have just stronger muscles and you can build stronger muscles with low intensity exercise, therefore not aggravating pain, you are going to have a less painful experience than if your muscles were weak, which is why, in my experience coming through my surgery, I was hell-bent on not going on 12 weeks of bed rest. I waited for the pain and the swelling to kind of come down after the initial surgical intervention, and I loaded myself with BFR and without in ways that didn't compromise me to maintain and then quickly build my muscle strength back up. And that was super important. I've got a mostly metal knee and I'm running an Ironman this year. Like the doctor had briefed me before saying, hey, you're going to have chronic pain, unsure of like the mobility level you will have, because I literally snapped my knee in half. And so I think like one thing that just cannot be understated here is like, if you want to be durable, and we're all fighting that aging curve. The more we age, the quicker we lose muscle. And I think age of 30, by the way, which most people aren't aware, is the tipping point. Obviously, it speeds up the more you age and it becomes harder to build back. But it's not like something we should only be thinking about when we're 55, 60, 65. And that's what a lot of people think about when they think about, losing muscle due to aging. We all think about our parents, right? We never really think about it applying to ourselves until it happens. But then you've got, and this is the use case that honestly, I use it for a lot myself. We see this an awful lot in the NBA teams that use Suji. So some of these NBA teams, every single one of their athletes travels with Suji in their training bags. And a number of them, because of the prevalence of ongoing chronic ankle and knee pain and instability in basketball, particularly because of the cutting and the moving, the harsh cutting and moving on a court, they use it as a pre-exercise or pre-match intervention, if you will. So they will do 7 to 10 minutes of exercise, consider a warm-up, with the compression garment on, to essentially elevate their heart rate and get this endorphin rush where your body naturally desensitizes to pain. So something your audience and even yourself might be able to relate to is if you just consider normal exercise for a second, where maybe you're going to get up and go on a 5K or a 10K run, and you just feel stiff. And then you get about a kilometer in, 2 kilometers in, you're maybe, 10, 15, 20, 30 minutes into your exercise session, and suddenly all that stiffness has gone away, you feel great, and then you get on the back end of the run, you cool down, and all of that stiffness comes back. Well, one theory or one belief as to why that pain goes away is something called exercise-induced hypoalgesia. And the principle here is that your heart rate elevates so much, or to a point, that your body releases a boatload of endorphins that are naturally desensitizing you to pain. Well, we can achieve the same thing with targeted compression training as a warm-up, but we don't aggravate the underlying pain in the process. So if you've got a sore knee and you want to go and join some exercise class, a yoga class, you want to go play tennis, golf, CrossFit, run, cycle, and a barrier to you doing that might be like, oh, my knee feels a little bit stiff, a little bit sore. Well, you could throw the compression technology on, do a 7-minute warm-up, which would literally be bodyweight squats, bodyweight leg extensions with the compression garment on, take it off, and immediately feel less stiff and less sore so that you can immediately go into your normal exercise. And then if you keep that cycle going, you'll get stronger, your load tolerance will increase, and your long-term experience with pain will also come down because your load tolerance is increased. And so there's the soreness, there's the pain, there's the post-surgical muscle strength building, and the kind of recovery. It's a really versatile piece of technology.
It's amazing what it can do. And I think it sounds like the idea is when you are able to use compression bands for recovery or warm up, then you have less risk of injury. And this is because you are warmed up, but without saying putting the impact. Let's say I can't run right now after a hip injury, but I can do other things. So maybe I'm better off doing the compression bands rather than going in cold.
I would always say you're priming yourself to exercise, which can positively contribute to avoiding injury. I'm always conscious of saying injury prevention because injuries can come from freak accidents. What I can say, and what I think is generally accepted, is the more durable you are, the more your body can tolerate. And so if you have a stronger musculature, when you roll an ankle, you're less likely to experience a significant injury. If you're more durable and you have a stronger musculature and you stumble and you are able to catch yourself because you have the fast twitch muscle fibers and you have the muscle strength to sustain that unexpected tumble or fall, then you are less likely to experience a significant injury. And a great way to experience this or demonstrate this is to take an elderly person who has significantly lost weight, who typically falls. And as we know, if an elder person breaks a hip and they become bedbound, it's a really negative, it's not a positive indicator to a good quality of life or even necessarily a long period of life thereafter the injury. So I always like to think of it in that, okay, if I can increase my muscle strength, my tendon strength, my bone density, so that my overall load tolerance is greater, if I fall, if I experience some sort of external stressor, I am much better prepared to not experience an injury. It doesn't mean you won't obviously be injured. And then of course, you're just more likely to exercise if you're in less pain. Like pain is such a barrier to exercise in general and life, we were, I think, talking about it before we started recording here. More than 50% of adults generally will experience joint pain. It's the biggest cause of disability worldwide. That number increases to about 75%, just over 75% in active adults. This absolutely doesn't mean we shouldn't be active. There's a roster of other benefits, but it does mean that we need to pay a lot of attention to being durable. And one of the things that's not in our favor is the aging process. And so as we age, we need to pay even more attention to it than perhaps we did before. And I think the unfortunate reality for women is they're disproportionately affected by joint pain and loss of muscle strength, as your audience will know, and as I've come to learn recently, because of menopause and the implications that it has, that has on it. And so I really like to look at, kind of bringing this all back full circle, I always like to look at this as being more durable improves your quality of life. And muscle health, as we refer to it internally at Suji, should really start being considered a vital health indicator if you want to live not only long, but if you want to live a good quality of life that's independent and you maintain your physical mobility.
You're absolutely right. And Dr. Von der Wright, who is brilliant, we've had an episode with her before. We'll have another one coming up soon. She is one, I found her through the Dr. Stacy Sims community, Feisty Menopause. And I absolutely was amazed by this community, because what I learned, the big takeaway I learned from them is that as we age, we don't slow down, we speed up. We have to work harder than we did when we were in our 20s. If you're interested in maintaining good health and vitality. So it's not about slowing down after 50. It's about getting stronger. And that's what I really love about this conversation. And I think you're absolutely right. It's such an important indicator of how the quality of life that you'll have, as well as how long you live. Because if you don't have the muscle mass, and you'd probably have more frail bones. And then if you fall and you have a fracture, then you're more likely to die within 6 months than if you're over the age of 65, let's say, than if not. So we need this. And the one thing you did mention too, also after the age of 30, we lose 1% of our muscle mass every year. And then when we get to menopause, we have 10%, all within, let's say, 5 years, more or less, 5 to 7 years, depends on which study you're looking at. But honestly, that's huge, a major acceleration due to the loss of estrogen and our other sex hormones. And then we lose another, then I guess things calm down, and then we lose another 1% until the age of 70. So when you think about this spectrum, let's say from perimenopause until you're 70, you've lost 15 pounds more or less of muscle. And that's huge. So how can we prevent this? And there's many things we can do. And it's not just using compression bands, but I have to say, as a gerontologist, I think, well, what about those people who just cannot move? I'm not going to tell my 85-year-old father-in-law to go start lifting heavy weights. Not going to do that, but he can maybe put on some compression bands and do certain things around home, or some very light mobility, or even, like you said, just kind of watching TV. It's better than nothing. And again, I don't think these kinds of things, these devices replace exercise. I think we all need to do it. It's just an incredible add-on for people who honestly just can't, or need that little extra gains. The bodybuilders who couldn't lift weight during COVID, and so they would use these bands and their baby weights at home, right?
I think that's such an important call out, the piece about normal exercise. Like, we're being really we're being really aware, or trying to create real awareness internally around not promoting this as something that should just replace normal exercise. And actually, one of the reasons for that, I mean, there's a roster of reasons for that, but one of the big ones is a strongly held belief that I have, which is exercise becomes, after the age of 25, 30, somewhere in that remit, exercise becomes as much about the social interaction as it does the physical health benefits. And so, I believe that I'm a huge advocate of group-based exercise. I love the boutique fitness rise that we've all come to see. I'm huge into anything that creates people moving with community. I think that this is a really positive thing for overall health, mental and physical. And so with Suji, or with targeted compression technology, what I would strongly encourage people to consider when they look at this is, okay, am I load compromised in some way? i.e., do I have an injury? Do I have a chronic disease? Do I have joint pain? Or do I have some real reason that normal, traditional, high-intensity exercise is not an option or is hard for me? Well, if the answer to that is yes, targeted compression technology, Suji, are a great, and I would argue the second best alternative for you. If you are able to do high-intensity exercise or normal traditional exercise, but have some stiffness or need to recover faster to benefit from that more, Suji also, or targeted compression technology, also plays a role as an accessory to your normal exercise regime. So that could be a warm-up to relieve joint stiffness or desensitize from joint stiffness or pain immediately before exercise. That could be using it as an accessory to build calf strength if you're training for a marathon, to protect the overall musculature, or quadricep strength if you're training for a marathon but don't want to overtrain by doing a lot of strength training and a lot of running. And it can also be used as a really effective recovery program after your exercise to reduce that muscle soreness. But I think, you know, what's great is that because it's so versatile, most people, almost anybody can find a reason to include this that will be very helpful, but it should not be at the cost of, I just don't want to do my normal exercise anymore. I'll do this instead for no apparent reason.
I think that's the dream. Everybody would love to replace exercise, and that's what we want to hear. So you may think about that. And that's why you and I are trying to reverse a little bit that thought. The studies that are done, there's thousands and thousands of studies that you can go on PubMed and research this till the cows come home. But there's so many studies that show people who are bedridden, who are injured, who are sedentary, who are surgeries, and they'll have a study where, okay, no bands, no BFR bands, and there's the BFR training completely lying in bed, not even moving. And then there's the other group where they'll do leg lifts, some kind of minor. And the ones who have the bands on are actually preserving muscle or building it. And that is incredible. So somebody looks at those studies and go, well, great, I'm not going to sit in bed and wear these things. I'm not going to make muscle. Like that's not the point. But when you read research like this, I can see where people's minds are going. And again, I think it's a matter of such a great accessory, such a great thing to have, especially when you just cannot. And when I found out about BFR, I was like, why aren't we speaking about this in gerontology? Nobody in my circles of gerontology knows this exists. I can't understand. So that's why I keep talking about it, because I think it's something that everyone should have and have access to. And that's why I'm so glad I found Suji. And we talked, you mentioned Suji without really saying exactly, what that is, but Suji is this technology. And if you're on YouTube, you can see these bands, these cuffs that you wear either on your arms or your legs. And I love this one because it's got the little Bluetooth, and you don't need air tubes and things getting in your way. And people are always asking me, how can I get some of this technology? But what's better, the tubes, the tubeless, the Bluetooth? And I personally love the Bluetooth because the air tubes are just a pain in the butt. And just like you said before, you were carrying around this in your rehab yourself, some big old device and the tubes everywhere.
It was on like an IV pole. It felt like a little, vitamin bag that I was running around the gym with. It was frustrating.
Yeah. I just got a hold of the Suji bands. I'm really excited about them because I've been using them for the past week. And so far, I am amazed. And the first impression that I had that really wowed me was the app, because I have never seen any other technology that has an app like this, and literally I can plug and play. And I get instructions. The bands calibrate to you. Okay, you go, okay, well, right. Because when I first started with the whole pump, the blood pressure cuff type BFR, I had to get instruction. I had to talk to a professional. I had to measure my arms. I had to make sure I was safe, because there are contraindications. So, which we'll talk about in a moment. But I'm amazed that technology's moved so fast, and now we can just literally put it on. I get clear instructions, and then you have personalized plans. So I really put Suji to the test, and I told the app, or the concierge, that I had hip surgery, I need a plan, this is my situation. And guess what? I received very similar exercises to the ones that I've been getting from my personal rehab training.
Oh, that's amazing. That's cool. That's really cool. Yeah, that's amazing.
So I'm like, okay, pass the test. I'm confident now in recommending this. And so I do the cyclical mode. It's just easier for me and more comfortable. But in the end, I'm wondering is it any different if I just move about I could either follow the plan like you have, in the instructions, you got Von der Reich. She's like amazing. She's got a video of her doing her exercises, and it's so cool because I feel like, oh, there she is. And then I get to 15 reps. I take a break, and then it tells me to decompress the bands, and then I do it again. So I'll have four reps, and I just follow the plan. It's super easy, super easy. And then you have the mode of, well, you can do your own thing, like go for a walk. So then I plugged in the next day. I was like, I want to go for a walk. Like, what do I do? And so it fills up the bands and stuff. But I'm wondering if I were to go on a walk and say, no, I want that cyclical mode. And your cyclical mode is like 2 minutes on and 1 minute off, or something like that. I'm not
Yeah,
sure.
so you kind of follow a little setup process in app and it gives you something. So it'll tell you, and you can like, if you lock your phone, it actually gives you a live view showing you how long these cyclical modes are, like how long it's going to compress and how long it's going to decompress for. And you can definitely go for walks with them on. Just be mindful of, I always wear shorts when I use them for walking because they seem to grip better than like a compression legging or something underneath it. So that would be the only watch out that I give you, but you can absolutely go on compression walks with them. I actually use it for my own recovery on a treadmill, typically because it's just more convenient living in a city, or low intensity cycle rides, like a stationary bike, low intensity cycle, and really just doing that kind of active recovery with it. But yeah, what we wanted to, I'm a huge believer in physical therapy, in-person physical therapy. I think physical therapists can be wizards. I've experienced it myself. The problem is that less than 11% of adults who experience joint pain, chronic joint pain that is, so the worst kind, will ever go through physical therapy because of convenience being the primary barrier. And then depending on where you live, cost of continuing to go thereafter. And so what I wanted to try and what I'm an advocate for is trying to bring as close to, I don't think you can fully bring it, but bring as close to the therapeutic value of physical therapy into the home or the discretion of an individual as possible. And so what we did with Suji was really look at everything that existed on the market, both portable and non-portable in this space, and say, look, the literature is really clear on this modality being incredibly safe as long as it calibrates to you, so you can never overcompress. And so that was one of the big ones. The other big one was contraindication screening. So you complete that during the sign up to make sure that you're safe to use the equipment. And then setting the compression relative to your calibration pressures or and so forth. The other big one actually is that people often overlook is the cuff width. So there's a relationship between discomfort and safety and cuff width. It's not linear, it's exponential. So as you're holding up, if people are watching the video here, our cuffs range from 8 centimeters to 10 centimeters wide. So that's the width, not the circumference, which obviously we actually go up to 38 inches in circumference because we service NFL football players, which is crazy. My waist is 32 inches. One thigh being 38 is mind-blowing to me. But the actual width, the cuffs that we use follow gold standard surgical tourniquet literature. So there's some amazing work that's been done in this space for many years, looking at the relationship between safety and comfort levels and cuff width. The thinner you go, it's an exponential relationship with the pressure required to achieve the same level of blood flow restriction. So, it's not saying, hey, you're half the width, therefore we need double the pressure. It could be 4 times the pressure, 5 times the pressure. And that directly impacts comfort and safety. If you think about this in the most extreme example, take a piece of string and wrap it around your finger really tight. That's really uncomfortable. And it's really uncomfortable because of how thin the string is when you're, and it doesn't take a lot of pull on the string to feel how uncomfortable that is. It's the same here. We're compressing the limb. And so we need to use something that is wide enough to reduce the level of pressure needed to achieve the same level of yeah, exactly. The same level of blood flow manipulation restriction, as well as not making it so wide it gets in the way of exercise. And so, this is one of the key design considerations that you have to consider compared to a blood pressure cuff or the big air boots that are typically used when you are completely static. You are not meant to move, so there's no noise, there's no difficulty with the movement. You sit it there and it does its thing. With targeted compression technology, it's intended to be used when you move. And so it needs to be wide enough that we, increase comfort, minimize discomfort, but thin enough that it doesn't get in the way of exercise. And we know from literature that 8 to 10 centimeters in width appears to be the optimal cuff width. But it is something people should really look out for when they're looking at different solutions. The old bodybuilder way of doing it was what they call grip it and rip it, which is where you have just a armband that you pull real tight. There's no standardization to this. You could be over compressing and over restricting, which could have a reverse effect. It could be harmful. And then there's just the safety of it and the comfort level. And so we did all of these things, but the next big thing that was missing was how do we take the physical therapist and put them right there with you, or as close to that as possible. And so in the Suji app now, you can come in, you sign up, you do the onboarding, you go through the calibration, the contraindication list, and you're ready to go. You can, as you alluded to, literally query it in what we call an unstructured manner, i.e. you don't have to put in the specific phrase you're looking for. You can put something like knee pain warm up, and we will return pre-recorded content from world-renowned medical experts and athletes. You've already alluded to Dr. Von der Wright as one of our medical experts, and we'll continue to add to this library of content frequently, and it will guide you through how to use this. So it's really like taking the prompt, or as close to taking the expert knowledge and putting it right there in the room with you on demand. And I'm really excited about that because I think it really differentiates Suji for a layperson who's maybe never used this before. It reduces significantly the knowledge base you need to use it successfully.
That's why they're so wide. I was wondering, why are they wide? But the whole string analogy makes perfect sense. Then you mentioned the contraindications. Let's talk about that. So who should definitely be staying away from technology like this?
I mean, the biggest sort of contraindication that people talk to are people who have DVT or some sort of negative cardiovascular event. I'm not recommending, to be clear, but I am aware that people who have been cleared to use BFR in the past, not by us, but by physicians in the literature base, to use it and have been safe in using it. But generally speaking, if you're capable, and the rule of thumb that we see applied is if you're cleared to do normal high intensity exercise, you're generally cleared to do blood flow restriction training, targeted compression training. If you're unsure, go and speak to a physician and get clearance for it. But the current contraindicator list includes DVT, negative cardiovascular event like a stroke, some neurological conditions. But I will say the reason that these are contraindications at the moment are not because there's an overwhelming amount of research saying that BFR negatively impacts these things. It's that there's not enough research at the moment saying that we are confident it is fully safe. But what's very exciting is that the literature base is constantly expanding and is showing BFR to be more and more safe. In fact, we have just concluded a study using Suji in collaboration and ran by the University of Central Florida, using Suji for at-home multiple sclerosis exercise-based interventions. And we had great outcomes there. We have a study in the UK funded by our National Health Service in collaboration with a university called Loughborough University, using Suji for at-home COPD, which is currently a contraindication, but using it for at-home COPD exercise interventions. And so, like I say, take the contraindication list seriously. If you have any doubt, speak to your physician or medical professional before use. But generally speaking, if you are clear and safe to do normal high-intensity exercise, you will be able to tolerate and be safe using BFR. And I'm excited to continue to see the safety of this science continue to prove itself as it has done time and time again, and continue to hopefully help people with any chronic disease, injury, or other ailment.
I think it needs to be that if you are clear to do high intensity exercise, it's okay. It maybe needs to be shifted a little bit, because when we think about myself and how BFR saved me when I could not,
True.
I was not clear to do high intensity.
True.
And it's been so helpful. Now I'm generally healthy. I don't have any other issues. Most doctors don't know what this is.
That's a great call out. That is a great call out. Yeah, consult the app. There's great blog content as well on our app will guide you through the contraindication list, so it'll keep you safe before you use it. There's great blogs and literature that is easily available online to help navigate this. What is exciting, particularly in America, is the awareness amongst medical professionals is rapidly accelerating. In fact, the American Physical Therapy Association published in one of their journals a paper that concluded, I believe it was a meta-analysis that concluded and recommended, I think the recommendation that came out of it was that blood flow restriction training be included in all. What was it? The conclusion of the paper was that blood flow restriction training achieves superior physiological adaptations at all timestamps of rehabilitation compared to traditional rehabilitation methods. And so to that end, like you say, not everybody who can do normal physical exercise are then contraindicated from BFR. So I guess it doesn't work both ways.
It just has to change. I mean, look at you.
It does.
Look at me.
It does have to evolve.
We were not able to do extra. We were recovering. We were injured. And this is what's been so helpful that you decided to create a company around it, your own technology. And I'm so excited about it because it helped me. I just keep talking about it.
I guess maybe I should have asterisked that, saying if you're normal, I don't even want to say normally cleared. What I was trying to get at is It's more the serious adverse health events that are the ones that have a big question mark next to it that you should get physician clearance from. So if you're somebody who currently has joint pain that's preventing you from doing normal exercise, or an injury that's preventing you from normal exercise, you're almost the perfect case study for using BFR. However, if you have some sort of chronic disease that has complications, or if you have a neurological condition that, you're unsure as to whether you should be doing this, that's the point you should go, well, I should probably consider I should definitely get, physician clearance on this. So perhaps not the best rule of thumb, but it can hopefully give people a little bit of guidance.
Yeah. So if you have any doubts, then you just talk to your doctor. What I did is I brought mine in to my doctor and I said, look, can I wear these? And at the time, I think it was 3 weeks or so post surgery I was doing it on the other leg, one leg that wasn't, but he said, as long as you don't put it directly on the scar, because it was still healing.
Yeah. That's a great call out.
Yeah, and this is somebody who doesn't really know anything about, I think, blood restriction, and he thought it was okay. And when you can think about, originally I was learning a lot about the katsu bands, which evidently in the 1960s in Japan was created for cardiac rehab patients. And that to me blew my mind. I was like, okay, wait a second. So if this is made for people who've had heart attacks and they're trying to recover, then there's something there. And it's like you said, it's just there is literature out there. There's so much literature. It's been there out since the 60s, at least, probably I don't know if before. Then there's enough. It's just that perhaps the doctors are just not up to speed. The rehab guys are, or the rehab girls. That's how you and I found them, right?
The last 15 years, this has been incredibly prevalent in sports medicine clinics and becoming really prevalent in neuro rehab clinics. We see more of that occurring, like I just alluded to as well, the MS study that we did with the University of Central Florida, UCF right there.
Dr. Dale Bredesen? Dr. Dale Bredesen?
Not where, no.
Oh, he's huge. He's the guy who wrote, The End of Alzheimer's, and he's a neurologist and many experience. And in his case studies and as well, he always recommends blood flow restriction. Yeah. Because of the brain benefits.
Yeah, I quite believe it. The guys we worked with were the group that led the work we were doing was a fellow called Professor Ethan Hill, did some really great work in this space. And, they first did it in a clinic and then they were like, hey, the results here are amazing, but this needs to go home. They saw the same thing as I felt when I was in a physical therapy clinic. Like, hey, I love being in this physical therapy clinic, but the reality is I can only, if I'm lucky, get 2 sessions a week, if I'm lucky. And I want to be doing this, and I really need to be doing this 3, 4, 5 times a week if I really want to see, the optimal benefit and most effective outcome. But yeah, I think it's going to become, there was a paper in 2019 that came out of, I believe it was St. Mary's, that concluded that properly employed targeted compression training, blood flow restriction training, which means calibrating, setting pressure based or compression based on that calibration and using an appropriate width cuff is just as safe as normal high intensity exercise. And even went on to say, for select populations could be safer because you don't have the risk of heavy weights falling on you or dropping them or moving incorrectly with them. And so, again, I do want to be careful with what I say, because I don't want somebody to go off and run and do this. And I think there's no risk. There's risk with anything, but I do think, and the research and the literature is very clear, that the risk level is incredibly low. And the biggest risk people have with targeted compression training is overestimating the intensity they can tolerate in session 1. And so, they kind of put the bands on, they go to a compression level that's maybe medium, which feels like, oh, medium, I'm comfortable with that. And they go straight into what feels like they would consider to be normal low intensity exercise. And they quickly realize, oh, wow, this isn't, this can get intense quickly.
You can measure your heart rate. I mean, I measure my heart rate with the bands on, and it's like, boom, boom, boom. And then I take the same exercise in the heart rate comes down.
Exactly. And so it's just, again, it comes back to that. And, what we said at the beginning of this is tricking your body into thinking it's working at a much higher intensity of exercise. The good news, and I think this is the big part, and Suji makes this really effective because it has the detachable compression unit. If you are feeling like it's becoming too intense, or if you feel like you've entered an exercise session that is too intense, simply remove the compression. And within less than 5 minutes, you'll return to homeostasis. You will be okay. And it really, just consider it like normal high intensity exercise, where you want to start out going, okay, let's maybe start with a low compression level. Let's do some body weight squats, do 3 sets of 10, 3 sets of 15, 3 sets of 20. And how did that feel? All right, it didn't feel intense enough. Let's maybe crank up the compression, or let's do a higher set rep scheme or a different exercise that challenges you a little bit differently, and venture into it that way. And I promise, one of my promises always with Suji is that when you have a real use case for it, as in you have joint pain, you have an injury, you have a load compromisation, you want to achieve improved muscle strength around your normal exercise program, you want to recover faster. Once you use it, you will continue to use it. And once you start playing with it, you'll start realizing how versatile a piece of equipment it is. It's not something like a lot of our recovery solutions where we use it for 2 months because we have a recurring sore muscle and then we place it down and pick it up a year later. It's something because of the use case, the broad use cases across, desensitizing from stiffness and pain, building muscle strength and recovering faster. You will, we've seen, actually, this is a great stat. We've seen in between January 1st and March 31st this year on our consumer customers, we've seen as a cohort, we can't see it at an individual level, but as a cohort, we can see the individuals complete between 44 to 173 sessions in those 3 months. So the sort of, average being the 44 and the sort of, I think about 12% completing north of 150 up to 173 sessions in 3 months.
Yeah.
I mean,
it's so
incredible.
easy. Yeah. I do every single day. I do it every day. It's just it's like a routine. It's part of my life.
And I think that's it. It's about easy habit creation. I do think that's often underestimated as well, where it's like, this actually becomes I travel an awful lot because of work. This is what I use when I travel, because I have no guarantee of my access to a good gym.
Me too.
I have no guarantee of how much time I'm going to have. And so being able to be in my hotel room and do 20 minutes of 2 different types of bodyweight exercises and then a standing recovery session and feel like first of all, feel like I'm exercising and getting the benefits of getting my heart rate up is tremendous. And then it also feels like I've not, reset when I come back into my normal training regime, and helps keep me durable,
And I think one point that is, as we're aging, we're telling, I'm just like everyone else, let's go lift heavy. Let's go lift heavy. And there is a risk of injury if you are not getting the proper training, or you have the poor form, or you just do too much, too fast, too soon. And so I think we should all lift heavy. We should continue to do that. But as we're aging, we also want to lower our risk of injury. And I think this is the greatest technology to do that. And that's, again, why I can't understand people in technology are not talking about this.
Yeah. I think as well, if you take it to one thing coming back to our earlier conversation that I always like to kind of joke about, and it's kind of a bit of tongue in cheek, but when people, I think our experience has been when particularly orthopedic surgeons hear about this and read a little bit of the literature, they become huge advocates. In fact, we have physical therapy clinics calling us now saying, hey, my referring physician or my referring surgeon has told me if I don't start offering this as a modality, they're going to start referring elsewhere, because particularly in that first 90-day post-surgical period where it's so important to preserve muscle strength and then hopefully build muscle strength back as early as possible, it's just so effective. It's so effective. And so, we're seeing the medical experts, the professionals, really start to adopt this and it become more prevalent. But for those who, definitely question, there are still a small, and I would call it a minority now, who question, well, aren't you, restricting blood flow? The big thing is we're manipulating. We are not fully. If you go for open heart surgery, they may restrict fully for 12 hours. Okay. So, we are doing it partially, and often for no more than, in most cases, most sessions last less than 15 minutes, 20 minutes and most of that is not continuous compression the entire time either. You will have rest and recovery where you're getting rep perfusion and completely unimpeding the blood flow. And so it's rushing back in. So, again, it comes back to that safety piece. It's always fun to point that out because it's a bit of tongue in cheek, but it's a useful one just to prod the logic sometimes.
So one thing I just want to point out, because I've tried so many BFR bands in my life, the thing that's really cool about this one, like look at this leg band if you're on YouTube. My husband can use this.
Yes.
I don't have to buy 2 different bands. And I think that is amazing, that how you've come up with that. So if somebody wants to get the Suji and they can share it with their partner or whoever, but you have an app. So if the calibration, can 2 people have 2 different apps and one set of Suji, or do they have to buy separate?
You can use the same hardware. The hardware is completely interchangeable. And one of the nice features of the detachable compression unit is if you want to buy additional cuff sizes, it's incredibly affordable to do that because you don't have to rebuy the compression device on top of it. Exactly.
Yeah.
Exactly. And so if you initially bought the leg cuffs, you can then later choose to buy the arm cuffs. Or if your partner or your spouse has larger limbs than you and they need a cuff size larger, well, then you can choose to kind of upgrade that, and it's much more cost effective. With regards to the app, at the moment, the app is recommended as single use because it stores your calibration data, and limb circumference is the biggest predictor of calibration. And so you need to make sure that you're using your calibration. So I would recommend 2 profiles. For your listeners, obviously, with apps, we were intentional about keeping the barrier to use low. So it's only $5 a month to use it. The first 30 days are free. We are considering, though, because it has been hotly requested, to your point here, about in the future introducing, and I don't know when this would be, but introducing like a family plan where you could essentially have 4 profiles under one account. We have, one of my favorite customers that has been regularly getting in contact with us is an orthopedic surgeon who uses this himself because he stands on his feet on a concrete floor for hours and hours upon end. And so wants a way to recover after being in the operating room and wants to strength train without loading his body because he constantly feels sore and achy from the amount of standing he does during surgery. Well, both of his children ski, so does his wife. One of his children, I believe, are competitive in sports, and so it's a great recovery tool for them. And then, of course, if anybody in the household suffers an injury, acute, major surgery, whatever, it becomes a great option there. And for him, I believe he's about mid-50s. Again, he's like, I can't get this stimulation that I get with Suji in normal exercise anymore. I can't lift heavy enough to get it because it hurts. And so it's nice to feel like I can build muscle strength again as another use case when he goes through sort of a strength training phase, if you will. So we are looking at some point in the future offering like a family plan where you can have a couple of profiles within one.
Cool. So how do you recommend someone who is literally brand new to compression technology? How do they get started with Suji? Like how many minutes a day, how many times per week, sets, and all that?
Yeah, I would recommend, of course, you can purchase the device on our website, which is trysuji.com. It will arrive at your home. The packaging is beautiful. I mean, I may be biased, but it's well packaged.
It is.
And even the packaging, like I have it actually here, the product packaging that the device arrives in. We really wanted to kind of go for the Apple effect with this. Yeah. It arrives at your home. You unpackage it. There's, help content and videos via our FAQ, our help desk, and on YouTube to set it up, where we'll guide you through the first time setup. Once you download the app, though, and this is where you're going to find the most help, it's very there's a lot of instruction given during that setup, including how to position yourself during the calibration. To be clear as well for individuals, calibration is something you only have to do one time. We do encourage semi-regular calibration, particularly if you go through large limb circumference changes. So if you're overcoming injury or surgery where your limb circumference changes drastically, do that more often. But it's really simple. Get the device to your home, you download the app, follow the in-app instruction, go through the calibration. Once you've calibrated, you're in the app. And I would encourage people to, first of all, the compression will never be tighter than the calibration you first complete when you're onboarding. That's a big point to make, because when you do compression on your lower limb for the first time, it feels quite foreign. It's not something most people have experienced before. And so that's a good introduction to like, hey, this is as compressed as it's ever going to be. And then I would encourage people for the first time to watch one of the instructional videos, find an exercise that they like and are familiar with, like bodyweight squats, lunges, attach the compression garment, follow the video in screen, listen to the guidance. It's only 90 seconds. And once you've done that once or twice and completed 1 or 2 sessions, you will become very proficient at setup and use. And honestly, you'll probably be able to skip through a lot of the video content, just getting the tidbits of information on the exercise prescription, the same way we all do when we follow normal exercise videos, where we kind of get the first couple, we're really into it, and then we just draw out the necessary information thereafter. But the app will really guide you fully through setup and use.
Cool. Yeah, and I think that's one of the big differentiating factors of Suji and some of the competition out there is that the app super user friendly. Yep. Well, you got the wide bands as well. That has the research behind it showing some better efficacy, and then the price point. Like it's so much more affordable than other things out there. So thank you for giving. Presenting it.
In America as well, if you have a HSA or FSA account, which is a health savings account, a flexible health savings account, these are pre-tax dollars you can use on healthcare expenditure. Suji pre-qualifies for that. So you can go on the website and use that as well, which makes it even more accessible from a consumer standpoint.
Oh, I love it. Oh gosh. Okay. Are there any other points that I missed that differentiated or that you'd like to share before we let you go?
No, I think just more for your audience. What I did do just before this, and a little bit of prep I managed to pull together, but before our talk today, was that there is a growing awareness in the women's health space on targeted compression training and BFR. I think even as far back as 2020, I want to say, was one of the sort of first studies that I found published in PMC. It was a 12-week study that showed low intensity targeted compression training improved muscle strength, bone formation markers, and balance in postmenopausal women. And so, definitely worth a shout out just because it's very relevant to the audience. But then, even literally yesterday, and I haven't read the paper yet because it was published yesterday in Nature, and this is more generally, but it was an article that shows targeted compression has been shown to increase levels of growth hormone, which we knew, and insulin-like growth factors, but specifically crucial for muscle and bone health. And so again, like just looking at how this literature is evolving, Nature is probably the most reputable publisher, one could argue, and April 14th this hit the press. So yesterday this hit the press and was published. So it is a continuously evolving space in a very exciting way, so definitely pay attention.
Oh, excellent. So I'm going to have the website on the show notes. It's trysuji.com. And you gave us a code. Thank you very much for 10% off using the code ZORA, ZORA. And I'll have a link to that in the show notes and your contact information and your Instagram, your Facebook, and people can reach out to you if they have any more questions, right?
Yeah, absolutely. We are very active on Instagram. We have, a very active customer service channel. So if you go into our help desk, our FAQ, which is in the footer of our website, you can also chat with us directly in there. And I would also just let people know that every purchase is protected with a 30-day money-back guarantee. So if this is something you're curious about trying, do, because I'm very, very confident that you won't be exercising that money-back guarantee. And of course, the app will help you massively. Our help desk will help you massively, but you can always reach out via social media or our chat desk on our website as well.
Oh, excellent. That's awesome to know that you have a money back guarantee. Even better.
Yes.
So,
yes.
Excuses.
People can try it risk-free. Exactly.
Try it out. If you're listening now and you made it to the end, thank you so much. And if you do try them out, I want your feedback. It's really important to hear from our listeners what you think about it, what you like, and reach out to me. So please do that. Have a great day, you, Alex, and as well as everybody else who's listening, and a good night, good morning, wherever you guys are. And hopefully we'll see you again.
Yeah, thank you so much for having me.